Hi all, in this lecture we're going to talk about portions of chapter 15, which focuses on neurological disorders. In this chapter we cover a variety of different causes of neurological disorders. First we're going to look at tumors and seizures, then we'll move on to cerebrovascular accidents. We'll also talk about TBIs as well as disorders of development, degenerative disorders, and then finally we'll finish with infectious disease. Firstly, we'll just look at the different types of brain tumors that can occur. We have different areas within the brain that can be affected, different types of cells that can be affected. Some tumors start off as affecting the supportive cells. So for example, the oligodendrocytes, so right here, these affect the oligodendrocytes. This type of tumor begins with the oligodendrocytes. Those are the supportive cells in the central nervous system. We also have the supportive cells in the peripheral system, so Schwann cells. That's where neurinomas start. Then we also have glioblastomas. These affect the glial cells or the glue cells. Those are also supportive cells in your nervous system. So I just wanted to show you this quick layout to demonstrate the different types of tumors, the type of cells that they can begin with, and then the different areas of the brain that they could affect. So for example, meningiomas affect the meninges, the cells of the meninges, the surrounding layers of the brain. Here we're taking a look at a couple of different types of tumors. This is an example of a benign tumor. You can see the arrow here pointing to the tumor itself. It's very large. It's actually occluding most of the right lateral ventricle here. You can see where the ventricle is, and it should look like this one here on the left. But you can see this tumor here is almost completely compressing this. Now, if you remember from previous lectures, the ventricles are filled with cerebrospinal fluid. So that fluid is going to be really compressed here with this type of tumor. Here we're taking a look at a CT scan. You can see the arrow pointing to a meningioma. That is the round white area there. So I wanted to show you what this looks like on a CT scan. Next, we'll take a look at seizures. Seizure disorder is more of the preferred term for epilepsy. Seizures are characterized, I think most of us think about them as being convulsive, so almost violent, uncontrollable muscular movements. We have a couple of different types of seizures. Generalized seizures are ones that involve most of the brain. So during the seizure, most of the brain is being affected. There are also different types of seizures that only involve a certain part of the brain. So it's more localized. So the rest of the brain more or less is functional, but that particular area of the brain is affected. I think the type of seizure that most of us think about when we hear the word seizure is a grand mal seizure. This is characterized by the convulsive actions that we think about when we talk about seizures. There are two different phases of grand mal seizures. The first is the tonic phase. That's where we actually have the skeletal muscles being contracted. And then we also have the clonic phase. That's where we see the rhythmic jerking motions. So the tonic phase is where we see someone's limbs draw up very tight. And then the clonic phase is the rhythmic jerking movements that we think about when we think about seizures. There are certain things that kind of go along with seizures. Some folks report something that we call aura. Some folks don't, but some people that have habitual seizures might report this particular phenomenon, and they define it as a sensation that occurs before a seizure happens. So it's a certain kind of a feeling or a sensation that seems to precede a seizure occurring. And on the one hand, this is kind of a positive in that it kind of gives the person a warning that perhaps a seizure might happen later. Maybe now is not the good time to engage in a dangerous behavior like driving, for example. There's also a different type of seizure separate from the one that we think about, the grand mal type, where we think about someone having a lot of convulsive activity. And this is kind of where we have an absence of that. We see this a lot in kids where it's kind of the zone out effect. It looks like inattention. A lot of times the kids may not recall what happened during that time. So if you were to ask them, hey, where'd you go? What were you thinking about? They may not even know what you're talking about. We call these petit mal seizures. So what causes seizures? A few different things can cause seizures. Scarring from an injury. So if you had a head injury or something like that, and there's a certain area of the brain that has scarring, that could potentially lead to seizures. Genetic factors. Sometimes we can inherit a disease that causes habitual seizures. Drugs and infections. So if you have a certain type of an infection of the brain, it can result in seizures. Certain types of drug use can also result in seizure activity. The treatments are anticonvulsants especially for grand mal seizures, and potential surgery as well to address the affected area of the brain if it is a partial type of seizure where only a certain area of the brain is affected. Then surgery might be one possibility to help limit or reduce, or maybe even completely eliminate seizure activity altogether. Now we're going to look at cerebrovascular accidents. So this would be mostly stroke activity. So there's a few different types of strokes. The first is the hemorrhagic stroke. This is caused by some kind of a rupture to a blood vessel in the brain. So a cerebral blood vessel actually bursts or ruptures, and that causes the stroke. There is also what we call an ischemic stroke. This is called by an occlusion of blood or a blood clot in the brain. So two different types of strokes. Way in which we might treat a stroke would be surgery if we need to go in and address the blood clot. Sometimes we get lucky and we notice the clot before the stroke actually occurs. Then we can address it via surgery. We can also repair some damage via surgery. We can obviously give the person anticoagulant drugs. If their stroke was an ischemic stroke, it was caused by a blood clot, then we might want to give them anticoagulants, or essentially kind of a blood thinner, to ensure that future clots don't happen. Further prevention would be looking at lifestyle factors that might affect blood flow, so things like atherosclerosis, so plaques, so looking at their cholesterol levels, also smoking, things like that can increase the likelihood of future strokes. And lastly, rehabilitation. So as you all are probably aware, strokes can, range in their level of severity depending upon how much damage was actually caused. But it is common for folks that have had a stroke to have issues with speech and mobility. So rehabilitation quickly after the stroke is key. Next, we look at TBIs, or traumatic brain injuries. We consider this in our country right now to be quite a serious health problem. Your book cites about 1.4 million annually treated in the emergency room. So that's a lot of TBIs. There are two different types of TBIs. We have closed versus open. So a traumatic brain injury is any head injury that results in a cracking of the skull that injures the brain. If it is a closed TBI, that means that the brain itself was not injured or penetrated directly. Whereas if it's an open head injury, that essentially means that something penetrated the brain. It could be an object or it could be a piece of the skull, but the actual brain itself was penetrated. One form of TBI is a chronic traumatic encephalopathy. So this is going to be where we see a lot of head injuries occurring over and over. We see this a lot in athletes. Again, this is going to lead to neurodegeneration over time. And again, this is a result of repeated head injuries. Think about football players especially. We're having a lot more media attention drawn to this because we're seeing these, especially NFL players, I would say, making news because they all of a sudden are having issues functioning. They may even commit terrible crimes, and family members will be reporting that they are basically non-functioning, that basically just a huge neuro decline in these individuals due to repeated head injury. So we're getting a lot more media attention, and it's kind of drawing an eye to the NFL in particular, really questioning how the game is played, and if the game is safe, what should be done about this to draw more awareness to this and try to prevent chronic traumatic brain injuries. The damage that's associated with this kind of chronic form of TBI is usually confirmed post-mortem. So this would be a post-mortem or after-death examination of the brain to really look at the damage that the individual suffered. So how can we treat this? Obviously, the first thing that we can do is reduce the brain swelling and intracranial pressure. This could be done via medication. This could actually involve taking a piece of the skull out to give the brain more room to swell, because initially the brain will need to swell in order to kind of protect itself. That's those microglia, those helper cells or supportive cells in the central nervous system. They are going to puff up, and that is the swelling that we see that occurs after an injury. So initially we need to let those microglia do their job and poof up and let swelling happen to protect the brain. And we first might need to reduce that intracranial pressure by removing part of the skull. It could be possible that medication to reduce swelling might be enough as well. But we first need to let the swelling happen, then reduce the swelling and intracranial pressure. And we also need to make sure that there's adequate blood flow. We don't want to have certain areas of the brain not getting enough blood flow. That could result in stroke. We don't want to have that. And we also want to treat the symptoms that happen after the injury. So this could be physical therapy, but it's likely to be cognitive or behavioral therapy as well. And we really want to assess these individuals more on a long-term basis. So these athletes, for example, that are engaged in heavy or high-impact sports that might be getting multiple head injuries, multiple concussions, we want to assess them long-term, because this is when we tend to see these things, more of the dangerous aspects that can go along with chronic traumatic brain injuries. Is we see behavioral changes, personality changes, cognitive changes over the long term, 5 years, 10 years, 15 down the road. We see a lot of deficits. So we want to assess these individuals on a long-term basis, not just short-term. Next, we'll look at disorders of development that can impact neurological functioning. We'll focus on the presence of toxic chemicals as well as genetic abnormalities, both those that are hereditary and those that are non-hereditary. First, we'll look at fetal alcohol syndrome. This is a result of the mother drinking while pregnant. It is a birth defect, and here we're looking at facial malformation as a function of fetal alcohol syndrome. So here we're looking at, on the right-hand side of the picture, we're looking at two different mouse fetuses. The one on the left, or picture A, is a mouse fetus from a mother that has been exposed to alcohol. The one on the right-hand side, which is picture B, is a typically developing mouse fetus, one that's mother has not been exposed to alcohol. And you can see the different formations of different parts of the face. In particular, you'll see more of a narrow forehead, you'll see a smaller nose, and then a longer upper lip. And you can see some of these resembled in the child picture here on the left. So these are just the physical signs of fetal alcohol syndrome, but obviously there are also neurological issues that go along with this as well. Next, we'll talk about inherited metabolic disorders that can result in neurological issues. The first is phenylketonuria, or PKU for short. This is a hereditary disorder that that's caused by an absence of an enzyme that converts amino acid to tyrosine. So this results in brain damage unless a special diet is implemented pretty early after birth. The next one is pyridoxine dependency. So this is a metabolic disorder that requires an infant to have larger amounts of pyridoxine to avoid neurological symptoms. So we have to do treatment pretty quick after birth for this one. The next one is galactosemia. So this is kind of an inability to deal with both sugar and dairy. And again, this can lead to neurological symptoms. And the last one is Tay-Sachs disease. This one results in neurological issues because there is an accumulation of fatty substances in the brain. which basically leads to the death of neurons. So this one is more isolated to a specific ancestry, specific Eastern Jewish ancestry. This is why typically when you go to the doctor, if you are pregnant, they will ask you if you have that kind of ancestry so they can test you further for the presence of Tay-Sachs in your developing fetus. Another one we can talk about here that leads to neurological functioning issues, which again is also a disorder of development, and this would be Down syndrome. So this is caused not by a deficiency of a gene, but rather an extra chromosome. So this is caused by the presence of an additional 21st chromosome. It's characterized by moderate to severe mental retardation. There is a fair bit of variability. Some individuals with Down syndrome can actually live in a group home and almost function completely independently, whereas some are in need of almost constant care. It's just going to vary from case to case. And there are often physical abnormalities as well that go along with Down syndrome. One of the most obvious ones is usually decreased stature. So they tend to be shorter than an average person of their same biological sex. Here we have the 3 different types of developmental disorders that we talked about. So exposure to teratogens. So this is going to be, for example, like fetal alcohol syndrome. So this is an exposure to some toxic chemical while in utero. And then we also have those inherited metabolic disorders like PKU, Tay-Sachs. And then finally, Down syndrome, which is again not an issue with a gene or a malformation of a gene. Rather, it's the presence of an additional chromosome on a gene. So here we can compare these different types and how they might look differently and what symptoms are associated with each one. Next, we'll look at different forms of dementia. These can be caused by several different types of disorders. The main 2 we kind of more commonly know about or talk about are Lewy body disease and Alzheimer's disease. Lewy body disease looks a little bit different than Alzheimer's. Specifically, Lewy body disease, like Alzheimer's, is occurring as a result of an accumulation of protein in the brain, but it looks a little bit different. That is, the symptoms look a bit different than Alzheimer's. Alzheimer's affects the ability of a person to form new memories, typically, whereas Lewy body disease doesn't really affect memories as much as it affects cognitive functioning and problem solving. So both are a result of protein accumulation in the brain, but different types of proteins and different symptoms are associated with the 2 different types of diseases. But we do classify both Lewy body disease and Alzheimer's disease as forms of dementia. We look at Alzheimer's disease a bit more closely. It is a degenerative brain disorder. Overall, we say that the origin is unknown. We do know that it's associated with progressive memory loss and also eventually motor deficits and eventual death. We do know that when we look at a brain post-mortem, we find amyloid plaque buildup, so essentially a protein plaque buildup in an Alzheimer's patient's brain. And this is something that, again, we can only confirm post-mortem, but we do see this in Alzheimer's patients. Some of the causes we think could be hereditary. Some forms do seem to be hereditary, run in families. For example, there can be a couple of issues with a certain gene. Presenilin, for example, the presenilin gene, that can be affected and that can result in a form of Alzheimer's disease. There can also be a epileptoprotein or ApoE. This is a genetic mutation that can occur that can cause dementia as well. So 2 different types of genetic abnormalities that can eventually cause dementia. Also, a level of education and lifestyle seems to have different effects on Alzheimer's. Specifically, it does seem as though folks that have a higher level of education and a better lifestyle seem to be less susceptible to Alzheimer's. If we focus on the plaque buildup, because that's kind of the hallmark sign of Alzheimer's, we can just further define that as, again, a protein or B amyloid protein buildup in the brain. And these deposits that kind of accumulate and build in the brain in Alzheimer's patients lead to the degeneration of axons. So the axons, the sending end of neurons, as well as the receiving ends of neurons, the dendrites, being damaged. And also we find that in these particular patients, we find activation of the microglia. Again, those are the glue cells or the supportive cells in the central nervous system. And these microglia, they're supposed to be pretty tiny, but when they're activated, they puff up or poof up. We see more of that in Alzheimer's patients as well. The treatment for Alzheimer's, unfortunately, there's not a lot. We mainly try to use inhibitors of acetylcholinesterase. So this is the enzyme that breaks down acetylcholinesterase. It breaks acetylcholine down into its parts, acetyl and choline. So we want to inhibit that process. So we give folks with Alzheimer's acetylcholinesterase inhibitors to increase acetylcholine availability. That does seem to be somewhat helpful. We also might try antagonists of the NMDA receptor, so to reduce the NMDA system. Also, we have looked at immunological research, and this does seem to be somewhat promising. Here we're looking at immunization. So this is looking at Alzheimer's patients who have been immunized against the AB or the protein buildup, that they've been given antibodies to help with the protein plaque buildup. And if you look at the orange line here, you'll see that this is reflecting the rating of cognitive ability of immunization patients. And then the blue folks are the Alzheimer's patients in the control condition that weren't given this immunization. And you can see that it does seem like the immunized patients are scoring better here, or they're maintaining more of their cognitive ability over a function of time. So this was done over a year period, and you can see that the immunized patients do seem to be doing better. So we are seeing a bit of success with immunizing against AB. And here we have just a kind of a sketch, I don't know, not an actual picture obviously, but just kind of a depiction of what a normal brain versus an Alzheimer's brain would look like post-mortem. What you can mainly notice is that the sulci are really wide in the Alzheimer's diseased brain. You can also see just overall tissue death, right? So you can see degeneration of the cortex, the brain is actually smaller. You see grooves that are wider. And if you look at tissue splices, you can see the amyloid plaque buildup. So if we're looking at picture A, you can see right there in the center of the picture, this is an example of an amyloid plaque. And on the right side here in B, you're seeing the neurofibrillary tangles. So this is going to be kind of clusters of amyloid plaques. And again, this is something that we can't view until we're looking at a brain post-mortem, but this is kind of the confirmation that this person indeed did have Alzheimer's. Next, we're looking at Korsakoff syndrome. This is something that is not hereditary or contagious. This is almost always due to environmental factors, mainly chronic alcoholism. This disorder results in a thymine deficiency. And what this does over time is it tends to cause anterograde amnesia. So you're going to have issues with forming new memories. So anterior grade, so new memories. So you're going to have issues remembering what is happening right now and what just happened recently. Damage over time due to Korsakoff syndrome is going to occur in the mammillary bodies, which are located kind of at the base of your brain, the older part of your brain, and the posterior area of the hypothalamus. The last bit here we'll look at are disorders caused by infectious diseases that are going to result in neurological issues, inflammation of the brain due to exposure to bacteria and viruses or toxic chemicals. A main example would be encephalitis, which is overall brain swelling. This can occur again through a few different means. One example would be just exposure to the herpes virus. Normally that causes things like cold sores or something like that, but it can potentially result in brain damage as well due to brain swelling. Also, the rabies virus. So this is a viral disease that is fatal if you aren't very quickly treated. It's usually transmitted through a bite, through a wild animal typically, but it results in brain damage. And again, this is fatal if not treated pretty quickly, again, due to a brain swelling. And here we're just comparing and contrasting two different types of swelling in the brain. Encephalitis is more of a generalized term for inflammation of the brain itself. So the entire brain is swelling and the brain is being pushed against the skull. Whereas here on the left, we're looking at meningitis. This is an inflammation or swelling of the meninges that surround your central nervous system or surround your brain and spinal cord. So a bit of a difference here. But again, these things can be caused, in particular encephalitis, can be caused due to viral exposure or some exposure to some kind of toxic chemical. So that is it for this chapter. Make sure to take a look at the chapter material more carefully, and I will be back with you in the next lecture.